Alright, we're going to target the serratus anterior in this video. So we have 3 exercises for you guys. The first one, targeting the serratus, will be a push-up plus. So you're going to have the patient either in full push-up form or in on the knee position. So you're going to have them go down into a regular push-up with hands about shoulder width apart, and back up. And then you're going to have them do the plus, really targeting the serratus anterior and getting those scapula into a protracted form. Another one, a variation of this, is staying in this position, just dropping the chest and then bringing up into the plus position. So straight down to dropping the chest into the plus position. Good. Okay, the next one we're going to do is a dynamic hug. So here we're focusing on the protraction and then retraction of the scapula. You can do this rapidly, but initially you want the patient to get the scapular motions correct. So you're going to have the patient come all the way out into full horizontal abduction and bring their arms across, reaching forward, really firing those serratus and bringing those scapula out. You can throw in self-mobilization of the scapula if the patient has the range of motion, but if not, the exercise works as well. I'm sure you've seen a little bit of this with Michael Phelps, and that's more of a stretch or a dynamic warm-up, but this has the same concept. And then the other one is a serratus punch with shoulder at 128 degrees flexion, and you want the arm in neutral or in pronation. You can have it in neutral or full supination. It doesn't really matter unless you bring it to supination, then it does, but we're just going to have the patient's hand in neutral here, and then you're going to ask the patient to go into that plus position. A good technique to use for verbal cueing is pretend there's a string through your arm and I'm pulling it out and pushing it back, just to get that scapular movement rather than a full rotation of the body. It's a little bit harder to educate some of the patients that have not done scapular stabilization before, so good verbal cueing may be necessary.